Hi there. My name is Dr. Arya Nielsen. I am here to thank Heather Tick for organizing these talks and IASP for inviting me today to talk on acupuncture therapy as part of comprehensive pain care. So, why acupuncture therapy? It's the NLM mesh heading. Um, for acupuncture therapy based in traditional East Asian medicine that's informed by a system of connected channels, organs, and tissues within which acupuncture needling is one intervention of acupuncture therapy. I'm speaking with you today about evidence-based medicine, not complementary medicine, which itself is a kind of a medical cultural term to marginalize therapies that are non-pharm. Um, Acupuncture is effective for chronic pain, effective for acute pain, has a substantially lower risk of adverse events and effects. Here, we're looking at a very large individual patient data meta-analysis. So they were able to pool 39 trials, over 20,000 participants who had chronic pain, and found acupuncture significantly better than sham or usual care. And interesting, 85% retention of treatment benefit 1 year following a course of care. Patients with more severe pain at baseline was the only predictor of response. And they improved more from acupuncture than those who had lower levels of pain compared to sham or non-acupuncture controls. And those are the citations for those remarks. Acupuncture for acute pain, we did a review of systematic reviews and meta-analysis, including newer RCTs of acupuncture for post-surgical acute pain and acute pain in the ED. And that paper is an update of an aspect of the academic consortium's white paper on comprehensive pain care. Acupuncture, we'll lift a couple of things from that. Acupuncture for peri and post-op pain was found to be effective in reducing pain compared to sham controls and usual care, with reduction in opioid need, importantly, at 8 hours, 24 hours, 29% at 72 hours post-surgery, and of course, lower incidence of opioid-related side effects, not just because of less opioids, but because acupuncture also treats these symptoms. Nausea, dizziness, sedation, itching, urinary retention, and those levels of response were reflected in a 2016 systematic review with meta-analysis in PLOS One. So we see consistency there. Acute ED renal colic pain, study found that acupuncture is faster and deeper analgesic effect and better tolerance than titrated IV morphine, which we think of as the go-to shutdown pain. And here in JAMA Network Open, with acute renal colic, N of 40 and 40, they provided acupuncture, now just 2 points on the top of each hand, in addition to injected diclofenac versus sham acupuncture. They found that response rate was higher for Virum acupuncture at 15, 20, and 30 minutes. It's safe, provides fast and substantial pain relief, less side effects, and with renal colic compared to sham acupuncture in the ED. Very important finding. In terms of opioid prescribing in acute pain setting is still associated with the risk of chronic use, with addiction and diversion liabilities. Acupuncture can, in its reduction of acute pain and opioid prescribing, has a compounding benefit and reduction of risk, and is therefore has a role in acute and chronic comprehensive pain care. A barrier to inclusion of acupuncture therapy is based in part on the myth of acupuncture as placebo, and careful reevaluations with network meta-analyses of those early trials found their flawed methodology because the shams they used were not inert. So they were not inert comparators. And this has led to a consort extension checklist on sham trial reporting called Accurate. Additionally, the benefit of acupuncture therapy in clinical setting has been shown then to be underrepresented in sham device trials. Organizations, including governmental, that have guidelines recommending acupuncture as part of comprehensive pain care: AHRQ, HHS, FDA, the Joint Commission, ACEP, American College of Emergency Physicians, American College of Physicians, American Academy of Family Physicians. This last group recommending acupuncture as first line of care for acute, subacute, and chronic low back pain. For those interested in my background, I include this slide here. I work as a senior consultant to NIH studies acupuncture for acute pain in the ED, and the Back in Action, acupuncture for chronic low back pain in adults 65 and older. Again, grateful to the IASP for inviting this talk today.